Cesarean hysterectomy is a life-saving procedure performed during postpartum hemorrhage following uterine atony, placenta accreta spectrum, and other obstetric complications. The incidence of emergency cesarean hysterectomies has increased over time, and the morbidity and mortality remains high. Furthermore, the anatomical changes of pregnancy compounded by the hemodynamic instability of a hemorrhaging patient make this procedure especially complex and time-sensitive. Despite its growing prevalence, many OB/GYN residents have never scrubbed as primary surgeon during a cesarean hysterectomy, and many may not feel comfortable performing a cesarean hysterectomy post-residency. As simulation has been proven to increase the comfort, confidence, and procedural skills in both emergent and non-emergent obstetric situations, we elected to design a low-fidelity model with appropriate anatomical landmarks that can be used for simulation of cesarean hysterectomy and aimed at trainee education. We will start by creating the uterus out of the large orange sponge. Using a stencil, trim two corners of the sponge. A knife is usually easier for this step, although large scissors will work as well. With a knife, poke along the edges of the stencil on both sides. Then peel away at the edge that will be removed and cut the remaining sponge away. Next, we will place the uterus in knee highs. Roll the knee highs up, then unroll them over the untrimmed end of the sponge so that the opening of the knee highs is at the inferior portion of the uterus. Fill 2 pink and 2 red spiral balloons. This can be done using a pipette or even with a trickle of water from a sink faucet. Make sure the balloons are filled as much as possible. Then tie off the end by wrapping the end around 2 fingers. After tying off the end, make a second knot about 2 to 3 centimeters below the first knot. When doing this, ensure that both ends of the balloon are filled with water. The shorter end will simulate the utero-ovarian vessels, and the longer end, the uterine vessels. Now we will attach the uterine vessels to the model. Cut a small opening at the superior corners of the knee highs. Then roll the knee highs up about 3/4 of the way and snake the tied ends of 1 pink and 1 red balloon up to the end of the knee highs. Feed the balloon through the opening so that the second tie is at the opening you just created. Repeat this on the other side. Roll the knee highs down to hold the balloons in place. To develop the round ligaments, cut 2 pieces of yarn around 33 centimeters long. Then cut 2 pieces of microfoam tape just over 33 centimeters. Place the yarn in the middle of the microfoam tape and fold the tape over the yarn. Then attach the round ligament to the uterus just anterior to the exit point of the balloons. It may be easier to attach the round ligament to the uterine cornua with a figure-of-8 suture or a needle and thread. Next, we will develop the vagina out of white felt. Cut a piece of white felt using an 11 by 21 centimeter rectangular stencil. Then fold the felt in half. Sew the 2 ends of the felt together either with a suture or needle and thread. This step can also be done with a stapler. In order to attach the model to the pelvic stand, rubber bands need to be attached to the vagina. To do this, cut 2 openings in the inferior portion of the vagina. Then thread a rubber band through as shown. Finally, with the knee highs rolled halfway up, fit the vagina over the trimmed portion of the uterus with the rubber bands facing anteriorly. The vagina should stay in place on its own if snug. To make it more secure, a piece of tape could be added or a figure-of-8 suture. The bladder will also be made from white felt. Cut a piece of felt using an oval stencil approximately 13.5 by 11 centimeters. Then fold the felt in half widthwise. Similar to the vagina, attach the edges together using suture, needle and thread, or staples. You can suture the bladder the same way the vagina was sutured. For example, consider tying an anchor and then suturing a running stitch. After you have sutured about 2/3 of the way, pause to stuff the bladder with 2 cotton balls. Then finish your stitch and tie it off. Place the completed bladder at the lower end of the uterus and roll the knee highs down the bladder and vagina to hold it in place. The next step will be to attach the ureters. Attach the opening of the yellow balloon to the posterior and inferior area of the bladder, simulating the ureters entering near the bladder trigone. Using a suture or needle and thread, attach the balloon to the bladder similar to the way the round ligaments were previously attached. In this video, we use a suture thrown twice before tying a knot. Then this step is repeated on the other side. Roll the knee highs completely down. Cut an opening in the knee highs to allow the ureters to exit. The final pieces to make are the fallopian tubes and ovaries. For the ovaries, roll a white 9 or 12-inch balloon inside out and grab a cotton ball with the inside of the balloon. Then roll the balloon back. Repeat for the other ovary. For the fallopian tubes, use a 2.5 by 16 centimeters stencil to cut them out of red felt. Next, wrap the entire model in press-and seal. Lay out a large piece of press-and seal longer than the width of the model with the ureters fully laid out laterally. The sticky side of the press-and seal should be facing you. Place the model on the press-and seal, followed by the fallopian tubes and ovaries. Adjust the utero-ovarian vessels so that they are pointing towards the ovaries. Adjust the ureters and round ligaments as needed so that the round ligaments lay over the ureters. Cut a second sheet of press-and seal slightly larger than the first sheet. The additional length will help cover the round ligaments. Note that the sticky side of the press-and seal should face away from you this time. After you place this sheet over the model, first wrap the round ligaments with the top layer of press-and seal, just lateral to the uterus. After doing this, carefully press down on the rest of the press-and seal, both layers against each other. Ensure wrapping the press-and seal all the way around the fallopian tubes, ovaries, ureters, and edges of the uterus and vagina. This low-fidelity model with anatomical landmarks has been well received at our residency programs for simulation of cesarean hysterectomy. Components adding to the realistic feel, such as the large balloons with water that simulate bleeding if not appropriately ligated, emulate the status of a gravid uterus and its vasculature. Such additions have been well received as well. The model is relatively easy to construct, and all materials can be purchased online at a minimal cost, especially when repeated for many trainees. Additionally, if constructed in bulk, the models maintain their integrity for months so that they may be used later. We hope that you find this model useful for your trainee education.